sebelum darurat diisytiharkan, I nak bagi tahu, masa tu mereka dah kata 171 orang dalam ICU and 76 orang memerlukan ventilator. So, bila situasi tu, kita dah kata kepada Seri Paduka Baginda that sistem kesihatan kita akan lumpuh. Tapi 6 Februari semalam, selepas PKP 3 minggu 4 minggu, kes ICU 305, kes gunakan ventilator semalam 139. Maka ada lebih 60 ventilator datang entah ke dari mana.
Ventilator itu datang because we asked for it loh. We source for it loh. Right? It's not like there's only 10 ventilators in Malaysia and then we are doomed. We have a lot of ventilators. We just, corral them, put them together and dedicate those ventilators for COVID-19 patients. It makes sense, right?
ICU ada lebih 130 bilik ICU datang daripada langit. Kita tak tahu macam mana. So,
again, what on earth are you talking about? Malaysia's healthcare system, we have a lot of ICU beds. It's just that now we have to dedicate more of those ICU beds to COVID-19 patients. And this has a hidden cost. The hidden cost is other people who need ICU beds, people who don't have COVID-19 but they require ICU beds anyway, now they don't have an ICU bed. Therefore, other people suffer, just that this hidden suffering which we do not see immediately. Let's take, for example, a case where you need to go for a big operation. Okay, now this operation may not be an emergency operation. Surgeons may have planned it weeks in advance, but because the operation is so major, part of the post-op recovery plan requires the patient to rest in the ICU, because in the ICU they have more nurses, more resources dedicated to one patient to ensure that this patient recovers fully from the major operation. Things like Whipple's procedure or a big heart transplant or a CABG where they replace the damaged arteries in your heart. These are major surgeries which require backup ICU beds. But now, because we have decanted those ICU beds for COVID-19, these people's elective major surgeries will have to be delayed because the bed is taken up by COVID-19 patients. So you see, there is a cost to all this. That's why we had to flatten the curve in the very beginning so that our healthcare system does not get overwhelmed by a sudden influx of COVID-19 patients.
Macam mana kita nak katakan tu that masa at the number 171, 10 January, you said the healthcare system collapsed. Today, in ICU, 305 people are in. And ventilators move from 76, 76 naik kepada 136. How come sekarang kita punya sistem nampak okay?
This is, in my opinion, the second most irresponsible part of Dr. Roland's video. Kita punya system nampak okay. Our healthcare system looks okay. I agree. It looks okay. Now, I've been out of the service for like 7 years, 6 years. But even then, I know that the healthcare system is buckling under pressure. I have friends who are frontliners and they tell me of horror cases where they have to sleep on the floors in alleyways because there's no place for them to rest. They are working their minds off. They are constantly stressed. Some of them have to get their own supplies, their own PPEs, whatever. No one in the public service sector, the public healthcare service sector that I know of seems okay. None of them are saying everything is fine, everything is perfect. No. The healthcare system is under a lot of pressure. And one of the best ways to alleviate this pressure is to get the population vaccinated so that it does not burden our healthcare system. So, once again, I feel that someone in your position, in your profession, should have released a more informative video to educate the public and to encourage the public to take the vaccines when it's available.
Kita buka lagi banyak jalan, kita buka lagi banyak business and everything. So, mathematically saying, you lied to us.
I'm not going to talk about whether or not we need a darurat or emergency to combat COVID-19. Okay, that's a whole different video altogether. But to defend KKM a little bit, I can kind of understand why someone like the DG of Health would say to people that our healthcare system will be paralyzed if we don't do something drastically now, right? Let's say, for example, you have 100,000 ringgit in your savings, okay? And you need about 5,000 ringgit a month to survive, right? Not even savings, just 5,000 ringgit to live. One day you lose your job and you go through 1 year with zero income. Now, the savings in your bank is down to 40,000. You have spent 60,000 to live, now you have 40,000 left. You're not bankrupt, you're not starving, you have a roof over your head, but aren't you panicked? Won't you be worried that if this continues, your resources will be fully drained and you're homeless and you're bankrupt? Of course. So I can understand the point of view of the DG to say, look, we are about to experience a healthcare emergency, a healthcare crisis. We need to do something drastic. Something drastic like get the goddamn vaccines. The vaccinations will prevent us from continuing down this slippery slope. And again, these kind of videos where you try and make people vaccine hesitant, this does not help the global and our national cause.
Data yang you sendiri buat, you tak boleh cover.
There is no proof that KKM has fudged the COVID-19 data.
Yang itu yang I rasa sedih lah. And kalau nak katakan PKP tu perlu, kita kena ambil kepada satu situation di Sabah, di mana kes di Sabah sangat tinggi. And bagi semua orang kat luar sana, Sabah hanya ada 3 hospital yang besar. Macam mana kat sana kes dah semakin hari semakin menurun, and you tell me that they could do it there, and dekat KL kita tak boleh handle.
KL and Sabah are not the same.
Singapura pun immunity, they all dah buka seperti biasa. Dia makan 8 orang satu meja.
You know what else has Singapore been doing? They have been vaccinating their people. Understand? Huh?